Um, Hospice is an organization usually outside of the long-term care facility, but not always, that can come in and help in a lot of different ways. They have specialized nurses that can come in and help with aggressive symptom management and control. They have social workers who can come and help with families and help with some of the financial and documentation and all of the things that are left undone that a family may not be able to do for themselves. They bring in their own chaplains who are well-versed in dealing with grieving families. They visit regularly. They work well with the long-term care staff and also with the attending doctor and with the medical director of hospice. They help to supply a lot of the symptom control medications that are frequently used in the dying patient. It's a wonderful organization, and most families are really pleased with how well they deal with grief and helping the patient process their feelings.
I think what we're seeing in acute care and in long-term care, that people are adopting a lot of those things that hospice has been doing for a long, long time. And they're developing plans of care which are called palliative or comfort measures only, which are focused on treating the symptoms, relieving the pain, relieving stress, and taking care of those debilitating symptoms of serious illness. It doesn't have to be provided by an organization like hospice. As good as hospice is, it does not have to be. And I think what people have realized is over the years, the things that hospice has shown us and taught us is that no matter if you are an organization yourself, you have a facility where you have all those people in place to provide that care. And what I am seeing from different places, from our local hospital, I have a copy of their plan of care. I have a copy of the one that we use in our facility, where you meet with the family, you develop a very individualized special plan of care. It's called a palliative plan of care. The person has to have a terminal illness, and that is usually verified by more than one physician. They have to have a do not resuscitate. And then we can talk with the family, talk to the resident, and say, what are your wishes? You know, do you want to have artificial feeding? Do you want to have IVs? Do you want to have all these things? And then leave that up to them and let them direct the care, their own care at that very important time in their life.
Explain the purpose of the Patient Self-Determination Act.
That's where hospitals, nursing homes, home health agencies, and HMOs will sit down with the patient and explain to them about advanced directives and things that they need to do to carry on their wishes for what they want to happen to them in the future. Like an advanced directive on who do you want to put in place to tell what you need in case you can't speak for yourself. Living wills. What would you like to be on a respirator? Do you want to have 2 doctors deem you brain dead or something like that before they wouldn't put you on a respirator? A living will just kind of sets the pace as to what you want, what you would like to have happen. And then the advanced directives, you can put somebody else in place to make decisions for you if you can't make decisions. Whether you want CPR or not CPR, or things that you would like to happen specifically for you, and that's what they tell. And they ask the patients, do you have an advanced directive? Do you want to make one? And they can kind of set you up with guidelines on what you need to do to make one.
And I think the advanced directives, excuse me, are really important, but I think we've oversold advanced directives and living wills. Because unless you have a healthcare surrogate has a legal right to make decisions for you, then you really are at the mercy of your family or a friend or whoever you've designated in that living will to help make decisions. But unless you have an actual health care surrogate, like in long-term care, someone else can't sign you in. A relative can't sign you in to a long-term care, and they cannot make some of those decisions for you. So it's very important that as part of that advance directive or living will or whatever you want to call it, that you designate someone as your health care surrogate.